really fighting a war over all of this for about 4 years in the legislature, was that we put one profession in control of everything. And they're not the only profession who is capable of being in control of their services. This is called the allopathic profession, which is the MD, conventional medicine. And about after World War I, this profession started taking control of legislatures and Congress and so on, and developing chemical drugs and so on, and building their empire. Well, treating war veterans and people who were injured badly, that was something new. It was wonderful, and it worked out fine. We lost sight of balance. And now the allopathic profession controls everything we do, all medical services, all healthcare services. They are on all the boards for workers' comp. They're on the insurance boards. They're on the drug company boards, and they control public health. Have where Wolf's talking about healthcare reform recommendations. I think he's talking about medical care reform recommendation. And I think we use the word health care loosely and in the wrong place. I think we do not have a health care system. We need one. We need one that stands alone, that is responsible for itself, that can be integrated with the medical care system.
The lady that I'm running against in the state legislature is Brenda Lander. Now she happens to be the chairperson for the Health and Human Services Committee, that's putting this hand up like this to almost any bill that has anything to do with lowering the cost, buying pharmaceuticals in bulk. She's cut programs for seniors. She's done any number of things to, quote, keep government out of your business, unquote. But the point is, that lady does not have any experience in healthcare. She has no training, has never done anything in that field. And yet she's controlling legislation that is life and death for people in the state of Kansas.
I was on that committee for several years too, and that committee is they're going to do just exactly what the Medical Society and the Board of Healing Arts tells them to do. And like any other association, one of our biggest problems in this country is not only the Medical Association, Medical Society, but we have, like my own profession, Association of Realtors, we have the Bar Association. These associations have grown so powerful, and the people at the top are taking care of the people at the top, and the people down at the bottom are paying the fees for it, but they're not getting anything settled for themselves. It's all to the benefit, pretty much all to the benefit of those at the top level of that profession.
You know, I agree that physicians are in control of our health care. But we have to remember that when we're the one laying on that table, do we want someone that doesn't have 20 years of education and 3 years of residency doing our surgery have to, I mean, we can sit here and talk about, yes, we really need to lower health care. I think we need to be looking at the insurance companies. They are for-profit, and as long as insurance companies are allowed to be for-profit, health care is going to continue to rise. And we also need to realize that insurance companies are controlling what physicians can do. They will say, no, you cannot prescribe this, or we won't pay for whatever. So know that physicians are greatly controlled by the insurance industry. I think that's important for us to think about.
It is, but I think that you really hit on the misunderstanding that we have here. No, you don't want a health care provider doing surgery on you. That's not their field. Equally, you do not want a medical provider who does surgery conducting your health care.
Well, and I
because
agree.
That's not his thing either. And that is the problem.
But I think that's happening. I think physicians, like Dr. Chappell said, have layers. They have PAs and they have nurse practitioners that are seeing the day-to-day people.
The medical,
Yes.
but not the healthcare. Healthcare is an entirely different thing, and it's something we don't have enough exposure to. We have more and more prescriptions coming out. I mean, it used to be somebody would just take one prescription per person. Now it's 5 or 6. We used to do 5 or 6 prescriptions. Man, you were on your deathbed. Not anymore. I mean, prescriptions are just fluent. And so imagine what that's doing to our environment, our very lives. I mean, we every day we're either eating, drinking, or breathing everybody else's prescription.